Hello guys, it's Unit 3 Part E. Today's topic, discomforts of pregnancy. During pregnancy, there are few conditions which causes discomfort to the pregnant women, and what are those conditions and what are the nursing care that we can provide for the pregnant women? Let's see it now. The very common one is nausea and vomiting. Nausea and vomiting is seen around 50% of pregnant women. This is also known as morning sickness. It is known as morning sickness because this symptoms is generally seen in the early in the morning, soon after waking up. Soon after waking up, the woman feels like vomiting, or she may vomit even, and soon after consuming the food also she feels vomiting. This is all because of increased hormone. What are the hormones that is generally increased in the pregnant woman? Those are HCG, estrogen, progesterone. Because of these hormones increasing vigorously, there is a change in her body. And if the woman is suffering from this morning sickness, there are few nursing advices that we can provide to them. Those are, don't stay in empty stomach. Don't allow the women to stay in empty stomach for prolonged time. Advise the patient to eat any kind of snacks which is healthy, and even advise the patient to drink juice, healthy juice, natural juice, not the packet ones. Eat in small amount of meals frequently. Instead of eating large portions at a time, you can advise the patient to consume small amount of portion food in the frequency of time, like 4 to 5 times per day. Instead of eating 3 times a day, she can have consume 4 to 5 times in a day. After waking up, eat salty food. Immediately after waking up, that is in empty stomach, the women should consume any salty item which will reduce the nausea and vomiting sensation. Generally, unbuttered toast is prescribed to the patients or the women. Avoid fatty, greasy and spicy food. This is very important because not just pregnant women, generally and if a person want to be healthy, they should avoid consuming lots of fatty foods, lots of greasy food, that is oily food, and lots of spicy foods should be avoided. Next, constipation. Constipation is due to the hormone progesterone which is increased in the pregnant women. Due to this hormone, constipation is seen, and this is not seen in all women. And the nursing care that we can provide for them is, advise the patient to drink lots of water. Generally it's 6 to 8 glasses. For in this condition, we can advise them to drink more water too. Eat liquid food and then semi-solid and then solid food. First, advise them to consume liquid food for 2 to 3 times and then move to semi-solid and then solid food. This will avoid constipation. And next, eat veggies and fruits. Advise the patient to stay in the healthy way. Instead of eating lots of meat and lots of non-veg, if they're consuming vegetables and fruits, this will be helpful in reducing the constipation. Drink juices. Advise the patient to drink juice which is healthy, which is natural, not the packet juice, and advise the patient to consume the juice with low sugar. This will help in the control of the insulin. Eat green leaf vegetables. Advise the patient to eat green leaf vegetables because eating green leaves increases the water level in our body, and if the water level is increased, it reduces the constipation. Mild exercise and drink warm water. Mild exercise is generally for the health purpose, and warm water must be consumed. Heartburn is generally seen when the woman is not consuming food for prolonged time. The woman gets acidity. Because of that acidity, there is heartburning sensation. And if the woman gets vomit, and because of that vomit also, she has a heartburning sensation. And the general nursing care that we provide for them is, avoid sleeping after having meal. Immediately after having meal, just go for an walking. Not for long period, at least for 10 minutes, go for an walking. That will help in digestion and heartburning will be reduced. Avoid eating late at night. Manage to consume the dinner within 8 or 9, not beyond that. If you are going beyond that, it may be not a healthy cycle. Swelling of the feet. Swelling of the feet and ankle is due to the fluid accumulation. For this condition, generally, the nursing care that we provide are not to sit with feet hanging down. When you are sitting in the chair or the table, make sure your feet touches the ground, not hanging. Keep pillow below ankle while sleeping. While sleeping, make sure you keep 1 or 2 pillow below your ankle. This will reduce the swelling or will avoid the condition. Next, leg cramps. Leg cramps is nothing but leg pain. This is generally seen in the night time while sleeping. This is because of reduced calcium level and vitamin B1. And generally it is because of the carrying the baby, the women legs get weighter. Like while carrying the baby, the womb is getting big and the leg of the mother is bearing the weight of baby as well as herself. So there is a pressure of uterus on leg nerves. Because of these three conditions, leg cramp is seen. This leg cramps can be reduced by following few advices. Those are like provide calcium and vitamin B supplements. Provide them this, and increasing in these levels can help in reducing the leg cramps. Before sleeping, massage the leg with using the warm water. Okay, while bathing or before going to sleep, use a wet towel which is dipped in the warm water and then apply on your leg. Even this reduces, or do massage with using some oils. This may reduce the leg cramps. Next, insomnia. Insomnia is nothing but sleep disturbance. Sleep disturbance in the sense lack of sleep due to discomfort position. When the uterus is growing, expanding day by day, the physical comfort will be getting reduced. So uncomfortable positions may be. The female may not feel comfortable while sleeping. Fetal movements can be seen. Because of that thing, female is unable to sleep. And frequency of maturation. Frequency of maturation is a common sign and symptom, and because of this, the woman is unable to sleep. These are the three conditions that leads to insomnia, and there are few advices that can be controlling. Take a glass of warm milk before going to bed. Before going to bed, if you take the warm water, it will help in getting the sleep. Take rest in afternoon. Instead of sleeping just in night time, do take 2 hours of short nap in the afternoon time. Supportive pillows. Use supportive pillows for comfortable position. Do yoga and meditation. This will help in providing comfortable sleep. And there are some other discomforts like dyspnea, fatigue, frequency of urination, backache. There are many discomforts, but generally these are the discomforts and the nursing care that are provided to them. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.